Many athletes are at risk for ACL injuries. Anybody that's competing in a contact or a collision sport is at risk for anterior cruciate ligament injury. Most typically, we hear about them with football players, soccer players, and basketball players. Typically, football has the highest rate of anterior cruciate ligament injuries, but soccer and basketball, specifically females participating in basketball, have the highest rate of injury, along with female soccer players. Girls are at more risk for tearing their ACLs because typically their pelvis is wider, which puts more stress on their knees. They tend to be more knock-kneed, or what we call genu valgus, and that tends to put stress on that ACL. The other reason is that they tend to have a little more narrowed notch. This is the area of the knee where the ACL attaches to, and in females this tends to be more narrow, and so that can impinge on that ligament and that can cause injury. So with repetitive activity, that notch, that space here, if narrowed, could pinch on the ACL and cause a tear. The other thing that puts the females at risk is they tend to land different than boys. They tend to use their knees more as a jackhammer as opposed to a shock absorber. So what happens is that they tend to put more stress on the knee, and the muscles tend to fire later than their male counterparts, and so what happens is the muscles in the front of the leg tend to overpower the muscles in the back of the leg, so that puts more strain on the anterior cruciate ligament. Anterior cruciate ligament injuries are often non-contact, which means that even though someone's participating in a contact activity such as football or soccer or basketball, it can just be rapid change of direction. Someone planting on a grass or artificial turf field and then rapidly changing direction, which causes a shift in the knee and often causes the anterior cruciate ligament to fail. So if any of the risk factors that we have discussed before are involved, someone is at greater risk for injuring that anterior cruciate ligament. Actions that athletes can take in order to prevent ACL injuries are many. First of all, you can participate in strengthening activities, specifically training the muscles in the back of the leg, because athletes that have greater risk for anterior cruciate ligaments tend to have more what we call quad dominance. It means that their muscles in the front of the thigh are typically stronger than the muscles in the back of their thigh. So working on strengthening up the muscles in the back of the thigh is very important to decrease those risks of injury. The other thing is working on how you land. So we know that athletes that tend to land and use their legs more like jackhammers as opposed to shock absorbers are at greater risk. So we usually will work with athletes on how they land from a jumping position. Say an athlete that goes up for a layup in basketball, teaching them how to come down and land properly is very important in decreasing the risk of injuries to the anterior cruciate ligament. So those are all steps that are important in decreasing the risk of anterior cruciate ligament injury.